Yes. Great. So our innovation is the mosquito awareness and reckoning system. So malaria is clearly a big problem around the world. There were over 19 million cases of malaria in 2013, and over 660,000 deaths. About 90% of this occurs in sub-Saharan Africa, and children under 5 are disproportionately affected. So there is a lot of good news too, though. 59 out of 103 countries endemic for malaria have met the Millennium Development Goal target to reverse the incidence of malaria, and 52 of these have actually reduced case incidence by 75%. So countries that have done a good job at, or have been successful at substantially reducing transmission face new challenges and changing malaria epidemiology. And there are actually 34 countries around the world right now, many of which are lower middle income, that have shifted from malaria control strategies to malaria elimination strategies. So when you're in a control phase, your main goal is to really reduce morbidity and mortality. But in a transmission, in an elimination setting, your goal is to completely interrupt transmission. And the challenge of doing that is that you have to identify both symptomatic and asymptomatic people within your population. So typically these lower transmission areas, and we'll use Swaziland as a case study here, you have these heterogeneous patterns and clustered disease foci of typically asymptomatic households or groups of households called hotspots, indicated in red. And case investigators and public health officials have to try to find these hotspots to treat people in those areas. So the way it works in Swaziland is you have a patient presenting with symptoms, so they are symptomatic, at a clinic. They're tested by either a rapid diagnostic test or microscopy. The result is reported, a positive result is reported centrally. Quality assurance is conducted by a more robust test. And a case investigator is dispatched to follow up on the positive index case to interview people, to test people in the field living within this person's area. One of the problems is that the diagnostic tools that are being used in these settings are not sensitive enough to detect people with very low levels of parasite density in their blood. And another problem is that we have to wait for somebody presenting with symptoms before we can actually do this active presentation. So we have developed a novel way to do this. And that is through an affordable, field-stable electrocuting grid system that would help us measure what's called the entomological inoculation, which I'll get to in a second. So basically what the tool will do is it will alert health officials to potential hotspots by measuring unusually high levels of mosquito biting, and will also alert local residents during uncharacteristically high levels of this biting, so that they actually use the bed nets that they're supposed to. So typically in these hotspots, there's such a low perceived risk of infection that people are not using bed nets when they should be. So the EIR is essentially a measure of malaria transmission intensity, and in an elimination setting, we want to get that EIR to below 1. And so to calculate the EIR, you need to measure the amount of bites per day. And so the standard way to do that is through measuring the amount of bites that a person is exposed to. And there are a lot of issues with this. It's difficult to do, it's time consuming, it's expensive, and it's also unethical because you're essentially asking people to, be exposed to pathogens. But a recent study has found that you can estimate the number of bites a person is exposed to per day, or gets per day, through use of an electrocuting grid.
Yeah, so the one that's shown up here and that was in the study is basically a 12-volt battery, an inverter, and then they have the electrocuting grid right next to the bed net. So you can see that's pretty bulky, cumbersome, kind of not that durable. Kids can get their hands in there, it's just not safe. So we wanted to improve on this and add to it. So what kind of our hack was basically to build basically this electrocuting grid that basically specifically targets mosquitoes and accurately counts them and kills them. So it would be solar powered because a lot of these places where it would be deployed wouldn't have reliable electric grids. It would be durably designed because it would have to be on the sun to be charged throughout the day on some charge cycle. It would be low cost. There would be some wireless connectivity, so it could talk from our device to another one that's locally right next to it in another household, and it would provide alerts. So it would basically, if there's a threshold met by counting mosquito bites within its local area, it would push a notification down, and it would alert the individuals that there's a swarm of mosquitoes out there. So make sure you use your bed nets. So I think we're going to walk through a demo right now.
This is our prototype design here. The neon portion was 3D printed, and it's basically designed to protect the users from electrocuting themselves. We have electrocution coils up at the top, and the device is solar powered. There's a solar array on top, there's a power switch. We have at the base the Arduino electronics, and we're going to be doing a demo to demonstrate the mosquitoes or bugs coming in. So we're going to switch it on. Now you can hear the high voltage basically activating the coils up top. And basically once we get to a certain number of iterations of bugs, there will be a run indicator that indicates. So we can determine that in our Arduino code, monitor that. We can send that wirelessly back to the grid, to the cloud, record this information to a central authority, and we have a number of other updates that we'd like to explain to you.
So if you want to go ahead and open up our mobile device, you can see our portion of bugs that were captured a bit earlier. So as a quick walkthrough, what makes this thing like nothing too special. The idea here is that we want to make sure the bug zapper is mosquito specific, and the way to approach that, it's really been driven by do-it-yourself sort of hackers and epidemiologists. There's been a lot of
It's very modular too, we have basically separated into 3 pieces, so it's easy to assemble. The idea is to have the users assemble this. So we're really boiling it down, lowering the cost, and making sure that it's accessible to everyone.
Along with being able to assemble that, one way to really add specificity is through some amazing work on odorants. So what's really incredible is that through simple household ingredients, peels and vegetables, yeast and sugar, you can actually generate a lot of the same cues that attract mosquitoes to humans. And obviously this is still an area of emerging research that we think we can really leverage that to add this kind of portability to our electronics.
Alright, so kind of stepping up a level, what is our mosquito awareness and recognition system? Is basically there would be clumps of villages that would get deployed with all these devices. There would be a mesh network, probably Zigbee protocol or something like that, that's low cost, that can talk to all these devices, and then there'd be a central hub that would push it up to a network that would feed back to the community and then the people that are actively doing the malaria control areas.
So ideally, people working for the National Malaria Control Program would be able to monitor when there is an uncharacteristically high level of malaria activity, which may be indicative of a hotspot that they can investigate.
And I think what's interesting is with the data, there's just going to be lots of insights and foresights that these people that are going to be utilizing the data to test out control mechanisms, test out new pesticides, they'll be able to have a lot active feedback loop that's all less labor intensive to collect the data because it's all coming out to them. And so that's where we are for questions, specifically the judges and then the audience.
So I don't remember what all of the variables were in the equation to calculate EIR. So you're counting the mosquitoes as you zap them. But what about the rest of the data you need to determine the EIR? When people eliminate malaria, are they really less mosquitoes or just less infected mosquitoes?
This has been an issue that we've been debating and thinking about very, very seriously. Do you want to
So we're not, this is designed to be more of an informative tool for people living in potentially risky areas and then as a surveillance tool. So the mosquitoes getting killed is just kind of like, I mean, it's enjoyable for us, but it's not, and it helps you detect in malaria bites, especially malaria activity, but the number of deaths that occur, mosquito deaths that occur with our tools is irrelevant, really. You want to be under a net for prevention. But sort of calculating the other components of this, the EIR is a standard right now. It's not the greatest thing they have out there, but you can calculate the sporozoite rate, or the fraction of mosquitoes present that are infectious by, I think, prevalence studies is what they're using.
I'm just wondering if the dead mosquitoes are collected in your device, could a public health person come out, take out the dead mosquitoes, push them, and do the rest of this? Would that be part of the model?
Yeah, so that's actually a very important part of the model, because in essence, you have a large collection of mosquitoes, but the caseworker has to come and test the individuals. They can simultaneously go in, collect these things, and we could also envision models either small to be sent elsewhere once you collect it.
So we're going to be counting. So once we get to a certain number of iterations, either the user could send these bugs back for analysis, or somebody could come on site. The idea is to just collect this data. We can expand this. We can module, basically adjust the amount of counting we do to report this back, and use checks and balances to monitor the types of bugs that
And based on the data, the central body can decide, we need to do an intervention here, we need to study the zone, because it's like an outbreak of something's happening, right? And so now they can detect that hotspot maybe a little earlier and see if the mosquitoes are infectious. There's no guarantee, but they could be, right?
So we also couldn't really find whether killing mosquitoes this way would prevent us from sequencing. But there are some new studies out there about sequencing for resistant strains of malaria, and so potentially could be something to as well.
I was going to ask the same questions for the last team. So, what's the sensing approach by which you count when the mosquito flies into your
Right. So basically, each time that the bug is electrocuted, there is a resistance, so there's a load, and we're detecting that particular load. We're using load sensing devices to allow us to get that information fed back, and then we basically just start counting at that point. Once we get to a certain number of iterations, we can feed that back through our overall Zigbee network to the cloud. So using some simple sensing technology will obviously keep the cost reduced each time. Do a lot of wireless devices as well as keeping the cost down.
We were also pretty interested in maybe seeing if we could detect sound, looking at different sound patterns for maybe different mosquitoes. Yeah, but we didn't do that.
So you said this would be used for identifying hotspot disorders or potential areas where additional intervention. Is there any correlated mosquito population that's linked to hotspot formation besides infection?
Yeah, so actually this graphic came from an article that specifically does this. You can see that, hey, here's a hotspot, and then this other region right here is based on data collected based on numbers of mosquitoes within that geographical area. And unfortunately, we don't have the legend here, but this is like large amounts of mosquitoes, not light amount, and then not that many. And so they actually correlated basically infections to mosquito densities in that article.
It's an inexact science though, so right now the standard, like we assume that higher mosquito activity correlates to higher rates of infection or transmission, but that's not, I mean, we're not completely sure about it.
I think there's also maybe an underlying assumption here that hotspot locations are unpredictable and unknown. This diagram here suggests something else, which is look for standing bodies of water, and so
They are unpredictable though, because you don't always have a hot spot that's near water, especially if you have mosquitoes that, so younger mosquitoes would be located here, but they can move away when they're more mature, and I believe that they are more infectious when they're older. It's been shown that you can't use seasonal patterns, you can't you can in some instances, but not for all spots.
One point that I've heard is that the particular mosquito is very resilient. You might just need wet footsteps. It's not that you need very obvious large body of water, so there will be more to do as well.
One quick comment that, and this is more of just an observation, Monopolies has a really big distribution range, whereas A's Aegypti has a much smaller distribution range. So I wonder if you present this as a model for dengue, whether you might be able to make this model a bit cleaner. That's just a thought to think.
Did you guys estimate a battery life for this after it gets no more solar?
So I think that's a calculus we walk through. Certainly, at this stage, we depend on them setting it outside on a daily cycle. But we can also use our standard LEDs to alert the person when power is running low.
I don't think it'll be too big of a problem.
So one more aspect was the educational aspect, because if this is meant as a do-it-yourself kit, the thought was that the science teachers would use it to teach the kids in the schools. So the children assemble it themselves and then bring it home, so that will help the adoption of the community and get more results.
And they can also support the research just to augment in terms of the actual LEDs that attract the mosquitoes. There's a study that we referenced where different types of LEDs on there are expected to be used in the discussion. These kind of experiments can be done in the schools, and this information can be shared to research officials, to ourselves, to further enhance our product. But it's modularized so that manually we can do it together. So it's very dynamic.